Hello, hello. I am Dr. Krishnakumar, consultant at JK Women Hospital, Dombivli. Today, we are going to see the concept of reducing time to pregnancy for the childless couple who are seeking pregnancy treatment and which can be a win-win situation for patients and doctors both equally. We all know, unfortunately, in India, none of the insurance company give any sort of medical reimbursement for fertility treatment, and couples have to pay from their own pocket for the expenditure involved, adding to a lot of inconvenience to them. Hence, if a couple is advised properly, they can not only have the goal of having a child sooner, but may end up in spending much less money if the appropriate guidance is given, because a delay in treatment, many of the couples drop out of fertility treatment even when they have a good chance of achieving a pregnancy. Well, to boost the natural fertility, every couple should remember that as the woman age increases, the chances of conception or becoming pregnant decreases. So for women who have regular menstrual cycle, sexual contact at least alternate day, 1 or 2 days before the fertile window can enhance their chances of getting pregnant. Any form of smoking or high consumption of alcohol should be discouraged, and lubricants in general should not be used whenever a couple is trying for pregnancy. Well, for others, once the diagnosis is made, like patients with PCO who have ovulation problems, simple medications can really rectify the problem and the pregnancy can be achieved much faster. But at the same time, women who are diagnosed with blocked fallopian tubes should not delay treatment and go for IVF or test tube baby immediately. When you consider the male factor, where the semen parameters may be of not adequate level, where the level is just minimal, one can wait for a couple of months with medical treatment or a short procedure of simple treatment like intrauterine insemination. Well, where the male factor is more severe, one should opt for the procedure called ICSI, which is a form of test tube baby itself. Majority of couples where all the investigations come normal, which are called the unexplained infertility, should maximum try a very short course of intrauterine insemination, maximum 3 or 4 cycles, before deciding upon IVF. And sooner the better in such situation. Well, endometriosis and fibroid is very common. If fertility enhancing surgery resolves the matter, they can be given a very short trial of natural or IUI, but majority of them will do better with an IVF. Today, the option of oocyte freezing or egg freezing is available, and hence one must consider, especially those with endometriosis, prior to surgery, they can freeze their oocytes, which can be used at a later date. Elderly couples or couples who have less ovarian reserve should not waste much time, and after a very, very short trial, one may opt for IVF. Well, today, women who have very less or no eggs in their ovary are also called as ovarian failure. The option of donor egg IVF is excellent and should be decided upon very, very easy, early. Well, couple who are going for IVF, they should have all those interventions which will improve the success rate in terms of getting pregnant at the first attempt, as many a time that may be the only attempt in a country like India. Well, today we have so many add-ons or adjuvants which are given in IVF, and as per the Human Fertilization and Embryology Authority of UK, one will be really shocked to find that majority of adjuvants or additional treatments do not play much role. This chart indicates, the red one indicates that that may be even dangerous. Well, green one is the only one which has been shown to be effective. The one which yellow have borderline or doubtful efficacy. None of the other which we are using may have any effect. Like if you look at all the adjuvants or the additional procedures which are being done, like assisted hatching having questionable mark, endometrial receptive or the ERA testing, and the immunoglobulin all have red mark, when they may be more harmful. The only steps which may sometime give benefit are freezing the oocytes for a for a frozen embryo transfer later, the hysteroscopy and endometrial scratching, and the use of embryo glue. Similarly, glucocorticoids and PGTA again has not shown to be of any benefit and may be harmful in certain conditions. All other procedures, including time-lapse imaging and incubation and IMSI, have all been shown to be of no benefit at all. Hence, it is, of course, imperative that once a couple is advised for a particular treatment by the treating fertility specialist, the couple should understand their own problem and without much delay should go for the appropriate step, and thereby it will definitely not only reduce the cost for the treatment, but it will ultimately reduce the time to pregnancy. Thank you.